So generally, I'm not going here unless I'm hunting for something. So the ulnar collateral ligament of the thumb is associated with a couple injuries, also known as Gamekeeper's thumb. There's a condition called a Stener lesion, which can also accompany this injury. Okay, but they have different meanings. So let's get into it. So often it's a two-handed job. So meaning I'm going to need to use my other hand for support. So hopefully you guys can see this. I'm going to, as best I can, support. So it's very key when you're using your offhand. You don't want to put them in too much valgus and just crank their thumb. So I'm going to use the thenar eminence here and buttress against the joint. So when I do stretch it, if they're supported. And so if in the case of an injury there.
And right now your lead hand is covering the, try with the other hand if you can.
Okay. Here, let me take a different window. So this is a little bit better. Let me know.
We can see it just fine now.
How this is.
Yeah, the audience can see.
Okay, thanks, guys. Thank you for your feedback. So it wouldn't surprise me. I know my other hand's in the way, but let me get to it. So have you had an injury here before? Quite possible. Yeah. Okay.
It's okay with that down.
Yeah. So let's just cover a couple things, and I'm going to do my best to give you a nice, crisp, clear picture. So we're going to start by orienting our bony landmarks. On the right-hand side, this is the proximal phalanx. On the left-hand side, this is your metacarpal. And the tissue that connects the two bones, this infolding, this is the ligament proper. And then off out here, because left is proximal, this is the adductor pollicis. So this is the muscle that brings the thumb closer to the hand. Well, over the top of that tendon or that muscle, as it forms a tendon, comes across. That's what this bright streak is here, and it loops all the way around. So it functions like a buttress over the top of that ligament, adding reinforcement. This is an inherently flexible joint, and so the anatomy is designed to have a little bit of give and take for movements, because we do so much with our thumb we don't realize until it's injured. So now we're going to get this view back, and we'll show you how we look at this dynamically. Let's see if I can do this without getting in my own way. Probably a little bit better view here. So two crisp, clear, bony landmarks. The ligament is the piece of tissue that's connecting the two bones, and over the top is our bright white tendon. And so the first things we look to clear, is there a Stener lesion? So most Stener lesions are when there's been an abrupt or forceful injury and a gap to this joint, and this tendon snaps a piece of bone with it. Most often it occurs at the proximal phalanx. However, we did have a recent case that came off the metacarpal, and it can happen. It's usually more of an outlier, but again, be on the lookout for it. So I look to clear that first, and then after this, we're going to do our gapping. So you're going to see, this is the challenge. I know my hand's in the way. So what I'm doing is I'm keeping the probe steady with my left, and my offhand, I'm just doing a little valgus stress. And you see everything's grossly intact. Nothing is pulling away and moving paradoxically.